Thank you. Good morning. I'm happy to be here. Thank you for the opportunity to speak today a little bit about what we're doing on antibiotic resistance. For those who are not familiar, the Pew Charitable Trust is a nonprofit organization that works on a wide variety of issues, from credit card issues, banking, jails, as well as health issues. And so my focus in the area that I work on is antibiotic resistance. Clearly, this is a priority issue. The Pew Trust has it as one of their largest health programs because of the urgency of it, recognizing how important it is and that it underpins modern medicine as we know it. This is Antibiotics Awareness Week, and there's a lot of good information being disseminated this week, new information and sort of raising awareness about this important issue. And so that's why we are interested in it and focused on it in our work. So the way we've divided our project at Pew is trying to address this issue from two areas primarily. Number one, how do we preserve the antibiotics that we currently have in the system, recognizing we need them to work for as long as possible, because at the same time, the antibiotics that we have we're starting to see more failure, we're starting to see more resistance. And unfortunately, we're not seeing innovation keep up with both current and future needs. So we're trying to work at it from two angles, from the stewardship of existing antibiotics, as well as trying to figure out how to jumpstart the pipeline of new therapies. It's been about over 30 years since a new class of antibiotics has been developed, which is clearly not meeting existing needs. But what I'll focus on today is the stewardship component. And what I wanted to do is talk about it both from a human stewardship and animal stewardship, and sort of see some of the parallels in the work on both areas. I thought I'd start with sort of stewardship. We've talked a lot about it. Clearly, the sort of the classic definition of stewardship is careful and responsible management of resources. In terms of antibiotics, what we're trying to do, as I've said, is keep the current ones effective, at the same time avoiding unintended consequences, both for human health, animal health, and the environment. And as you all know that work in this area, that's not easy to do always. We need to understand what we're trying to do and how our interventions are actually affecting change. So first I'll talk a little bit about the human stewardship work that we're engaged in, and I'll look at it, our approach, Pew's approach to things is what are the policy opportunities to drive change. And the way we do that is we look at information, we look at data, what data is out there, what data needs to be out there. Sometimes we'll do some research, we'll work in partnership with others. We look at, so again, then what are the policy opportunities there? And on the human side, stewardship core components has been an important piece of the work in the last couple of years. As you all know, CDC developed those a couple of years ago, and those have had a tangible impact on the uptake of stewardship in different settings. And there are some policy levers on the human side that have helped drive that change. For example, on the acute care side, we've seen an uptick of stewardship programs being adopted in hospital settings, and that there are different reasons why that might be happening. One, having those core components available. Now hospitals know what needs to be in place, what they're going to be potentially evaluated on going forward. And I think a growing understanding of the importance of stewardship has driven that, as well as a requirement from the Joint Commission, the accrediting agency for hospitals. Once they had those core components, they could then require stewardship be part of hospital programs. And so all of that is feeding into an uptick. Clearly, we'd like to see that go even further. And one of the ways to do that is the federal policy levers from the HHS. There's a requirement that they can put in place for participation in Medicare programs called the Conditions of Participation. For the acute care hospitals in August of 2016, there was a proposed rule for those requirements. Unfortunately, it's not finalized, so one of the things that we're doing at Pew is trying to push to get that finalized, because we'd love to see that happen, and that would drive uptake of hospital stewardship programs across the board. There is a long-term care requirement for stewardship programs that was finalized. It's not been fully implemented, but the expectation is that will be implemented in the spring. So we'll continue to monitor that. And then on the Joint Commission, as I mentioned, that has been in place since January of 2017. And I think the Joint Commission has recognized that they have the basic requirement, they know what the core components are, they want to keep driving sort of continuous quality improvement of the program that's in place. We're working with them a little bit, as is CDC, to try to figure out how to make those programs even more meaningful and useful. And then switching to the outpatient side of things, that was all inpatient. The data is okay, but the policy levers are available. On the outpatient side, we sort of have the opposite scenario. We have better data, but less clarity on the policy interventions. This is not new. You all may have seen this before. Pew partnered with CDC to evaluate inappropriate use of antibiotics in outpatient settings and determined 1 out of every 3 antibiotics is unnecessary. And that translates to about 47,000, I think it's 1,000 million, a lot of prescriptions a year that are unnecessary. And so this is the data we have. It's a benchmark. I heard some folks talk about the importance of benchmarks. Now we know there is an inappropriate use, and then how do we measure progress going forward? It's an important data point that needs to be out there. We're doing a similar thing on inpatient, trying to get a sense of the inappropriate use there. The data's not as good, so it'll be a little harder, but looking forward to that data coming out in the next year. So what's next on human stewardship? How do we continue the drumbeat, continue to have implementation? Obviously, those conditions of participation, we'd love to see those finalized. Continuous improvement on the stewardship programs, as I mentioned. How do we make them as robust as possible as we learn more about the science and about the interventions and making sure they're having the impact, the intended impact? We'd love to see more data. There's a system in place for gathering data from hospitals, but not enough hospitals are participating in that. How do we drive that participation? What are the incentives? And then on the outpatient side, the big challenge there, again, as I mentioned, is what's going to drive uptake of stewardship programs? What are the incentives? We're looking a little bit at behavioral drivers. That was mentioned yesterday. Critical piece of it. What is happening? Why are people doing what they do, even if they know better? There's a lot of pressure on physicians to sort of satisfy their patients, for example, and they're concerned about getting rated or that the patient might go to a competitor. So there are different pressures. So how do we take that into consideration and drive uptake of stewardship in that environment? So we're doing some work on that. We did a literature review of what we know on behavioral drivers. We had a meeting a couple weeks ago at CDC to further understand what are the key issues, questions we need to answer. And so we'll be putting more attention to that, while at the same time looking at what are the drivers that could provide the incentive. We're doing a little bit of work with insurance companies to see if they can help develop incentives for outpatient providers. So that's where we are on the human, as I said, sort of the data piece, the policy piece, and information, and also I should say partnerships has been an important piece of moving that agenda forward. So then switching gears to animal stewardship and what we're working on there, we and others, this is a partnership effort. I wanted to mention a couple of things, and then Joe's going to get up and talk about sort of the stewardship piece of this. But I wanted to mention the FDA report. I'm sure you'll hear more about that, but we're happy to see the strategic plan that they released recently that mentions a number of issues that we are interested in and interested in seeing go forward. And because these will help the stewardship efforts that are happening around the country now on the farm, and it will help provide the tools and the resources and the information that folks need to, again, that continuous quality improvement. And I'll mention three issues here that we're particularly focused on. One is making sure that all antibiotics are under veterinary oversight. As we know, the water and feed ones are already under veterinary oversight, but there are some critically important antibiotics that are still need to have that oversight. So we're looking forward to that moving forward. There's mention in here about data. To us, that's so important that we have some data right now in animal ag, but it's limited, as you all know. The more information we can get about antibiotic use and what it's being used for and how long, et cetera, will help, again, drive our knowledge about how antibiotics are being used and look for opportunities for improvement. And then the third thing is on the antibiotic labels. It's mentioned in here in the report about the importance of making sure that the labels on the antibiotics in animal agriculture align with judicious principles. We did some analysis a couple years ago, even after the 209-213, and still about 1 out of every 3 labels is not meeting judicious use principles. So the more we can get those in line, the better it'll be for the providers on the ground when they're using these important tools. And then I just wanted to mention a couple other things. Another thing we recognize is, what do we need to do as a community to help reduce the need for antibiotics, and what are the research needs that are out there, whether it's management practices, alternative products, et cetera. So we've convened, we're actually in the next couple weeks having a small convening to look at alternatives. What are the primary areas where we need more alternatives? What are the research priorities there? And how do we continue to move that agenda forward? One of the things we did a year or so ago was look at did an in-depth analysis of the research that's been done on alternatives to date, and identified where the research demonstrates that they can be effective in different species and where there are gaps in that knowledge. And again, looking at this from the tools, what could we make available that would help on the ground reduce the need for antibiotics? So I think I will stop there and let Joe start talking about the stewardship workers.
Thank you, Kathy. I think I was here a year ago. We were in Washington, D.C. and gave you a bit of an update on what we were doing with the shared work that the Farm Foundation and Pew have been doing. And what I'm going to do is do a bit of a recap today, and then Kathy's going to kind of talk about where we're at with this project. But I retired from Hormel Foods a couple of years ago as Vice President of Legislative and Regulatory Affairs with the company for the last 13 years of my career. So I guess you could say I'm a recovering lobbyist at this point. So don't hold that against me. It's behind me now. But one of the themes for this, before I get into the work that we've been doing with Pew and the Farm Foundation, one of the themes is talking about to ensure optimal antibiotic use. And since I've retired, I'm on with a couple of projects yet for Hormel. I'm leading their antibiotic discussion group. There are a number of people in this room that are actually a part of that group. What we've done in the company is put together a team from internal and then bringing external sources in to discuss antibiotic use. If you don't know, Hormel owns Jennie-O Turkey Store, or also conventional pork. We own Applegate Farms, which is the largest organic antibiotic-free meat company. And so we have a very diverse portfolio with that. So it was important for us, I think, to bring together a working group to talk about what is going on in the antibiotic side. So we discuss latest industry information. We review research studies. The group explores opportunities related to antibiotic usage in meat production, discuss definitions around antibiotic use, and try to understand the scope and the conviction of consumers, what they're doing. So it's an ongoing group. We try to meet 3 or 4 times a year to discuss this. Actually, we're meeting in a couple weeks because there's going to be a report out we'll talk about a little bit. But that's just an example of and I think many companies out there are doing these type of things, and I think it's important to have both an internal and external perspective with that. So that's very important. So a year ago, Kathy and I were here together, and we talked a little bit about this, but what I want to do is provide you with an update on where we're at. And so at the beginning, it started back in 2015, and Dr. Flynn and I were talking about this yesterday. A group of us from the Farm Foundation. If you're not familiar with the Farm Foundation, it's based out of Chicago. It's an 85-year-old organization. It's non-lobbying. I guess the simplest way to talk about this organization is we are a convener. We bring food and ag together to discuss issues rather than fight over issues, to come up with solutions. So an example of the work we're doing is with the Antibiotic Stewardship, an antibiotic discussion group that we have. We've also just started and launched a Food and Ag Trade Resource Center. And if you haven't noticed, trade is a rather big issue today. What we're doing is actually providing basic definitions of what trade is. We're just republished a report out of Purdue that actually talks about the North American Free Trade Agreement. Actually puts it in terms your mom can understand, and just talks about the implications. So that's the kind of work that we do with that. If you want to look them up, you can just look up Farm Foundation on the net. So in meeting with Bill, Mike Taylor at that time, back in, I think it was February 2015, the VFD 209 and 213 had been initiated. And when we met with them, they had only had enough funds to go to 5 different markets in the U.S. to talk about the responsibilities and inform people what these new guidelines meant. So we talked with them. We said, we're here from the private sector, and we're here to help. And it ended up working out well that we did. We ended up doing 12 listening sessions around the country. We raised about $350,000 to do this. We partnered with USDA, FDA. Bill went to a lot of these sessions. Larry Granger here from USDA spent a lot of time at those sessions. And I think it was a beneficial thing for everybody. Some of you might have been at some of those sessions in the 12 different locations we had around the country, as it gave an opportunity for producers, feed producers, processors, a chance to interact directly with some of the key officials at USDA, FDA. And that itself, I think, was a pretty big deal in having those conversations, because we heard from many of those people that meant a lot to them. They actually had a better understanding of where each side was coming from, and I think that was very important. Once we did that in January of 2016, then, we did a national summit in Washington, D.C., where we brought our findings. We had done pre- and post surveys going out to each of these strategic locations, and we found out where there were some gaps with regards to the education that was out there. And we did find out there were some big gaps, particularly in the more rural areas where a veterinarian may be 100 or 200 miles away from a producer, and that relationship wasn't there. How do we bridge that gap? And we also found out there were some big gaps in metro areas where there are all the hobby farms. Many of these people did not know what the responsibilities were with 209, 213, and the VFD. So at that point, we ended up to raise more funds with some help from some folks, and we went out to try to educate those gaps that we had found. So I think it was an effective process, and actually when it was implemented, I think in 2017 then, the implementation went, I think, much better. At that point, we thought, okay, is our work done? During this process, I think it was like 2.5 years ago in Tucson, Arizona, Kathy, Talkington, and Karen Holzer, Dr. Karen Holzer, who's the veterinarian at Pew, came out and visited with us. They had contributed to that $350,000 to do the education process. And we started discussing on what can we do next? What opportunities are out there? Do we stop now? But we thought there were some great opportunities. And so our big idea was, what if we tried to bring together producer groups, pharmaceutical, processors, retailers, food service together, all that supply chain that deals with this, and start having discussions across the table from each other. And so that was a big idea back then. And it wasn't an easy idea to implement. And so many times in the past, as we've done before, we sit across the room and we fire shots at each other, but we seldom will go and sit across each other from the table. And so after some discussions and I think convincing of some of the groups, I had conversations with some folks probably in here and other organizations with my background. We convened in Washington, D.C. in December of 2016. It was, so it's almost 2 years ago. And we had our first meeting. And that first meeting was just kind of getting to know each other, starting to get comfortable. And it actually took a couple meetings. I have to give Dr. Steve Solomon credit. Steve has moderated this group for the past 2.5 years. He's herded the cats, and he's done a pretty darn good job in doing that because we're very close to releasing our initial work publicly. And so that was a big deal, just getting everybody in the room. And at that point, we started to find out we had a lot more in common than we did in differences across the board. And I think that was some of the biggest things that was brought out of this was it was no small task to bring everybody together, but just having those conversations face to face meant a big difference. So where we're at today is that we're close to announcing some of our initial work. Kathy's going to talk a little bit about that. Well, there's been a lot of work done. Our thinking was there's been so much work done by each individual groups and so on. What can we do to collate that? And we started taking everybody's sustainability statement. We started taking all their principles around this, and we kind of melded them all together. I give Karen Holzer credit for this. She kind of put them all together and grabbed everybody's and took out key words. And we ended up writing a sustainability statement in about a meeting and a half. Steve said it took the medical industry 70 years to do that, so we felt pretty good about that. One other outcome of this was Dr. Holzer was invited by the National Pork Board and NPPC to visit Des Moines. She had never been invited there before, and went down there, and she came back so enthusiastic by the work that they were doing. She didn't know the work that they were doing, didn't understand the work that was being done. And after that, the National Turkey Federation invited her in and so on. So it's these type of things that made a big difference. And I'm going to close and let Kathy talk, but one thing we did stay away from with this group was and it's a very important part of this, was the measurement side. Because we know that Mike Apley, that was here yesterday, Peter Davies is here for the conference, Randy Singer, they're all working with a different species group to do that, and they're working very closely with the FDA to come up with these type of measurements. We didn't want to get in the middle of something with that, with the other group doing, so what we've done, we've kept each other, I think, informed and organized as what we're doing moving forward. So with that, I'm going to ask Kathy to just share with you a little bit about the work process. Again, we don't want to scoop ourselves because we're going to do some announcements, I think some pretty big announcements in a short period of time, but Kathy can share a little bit more about that.
Thanks, Joe. And I'll just add a little bit more. And it was interesting, I think, in the session this morning, hearing, and a little bit yesterday too, the challenges that we're sort of dealing with in this industry. There's a lot of confusion. There's consumer confusion. There's industry, different opinions. And part of what we did together initially was had a series of interviews of folks along the food chain, and we heard similar themes that it was unclear what the expectations were, what is the roadmap going forward, is there sort of a way to move across the whole food chain? Can we come to agreement from producer all the way to buyer on what stewardship means in animal agriculture, and how do we demonstrate that? And not only from sort of along the food chain, but also across species. Is there a level at which we can define appropriate use and stewardship that is meaningful across the food chain, across the species? And so that's what we have been working on for the last couple of years. It's been a productive and interesting conversation. And I think, so what we will be talking about in our announcement is that definition of the core components of what a stewardship program looks like. And I think part of our rationale for that as well, in addition to what we were hearing from the various folks in in this space was we've seen the success of that on the human side. Once you understand what a meaningful program looks like, then you can begin to have some common understanding, some consistency across and between. It sort of levels the playing field in some regards, makes it more predictable in terms of the expectation. So we think that's a really important first step. I think I should also say we recognize it's not the only step. There, as I mentioned on the human side, there's continuous improvement in this. Once we learn more about alternatives or management practices, that'll need to be incorporated. Once we have better information, better science, better data, and that all helps. And as I mentioned, the FDA plan, all of those tools that are coming out will sort of amplify the information that goes into these stewardship programs and makes them have the intended consequences that everybody's looking for, and as a way of demonstrating to the consumer and to the buyers that they're meaningful programs that are ongoing and working continuously to improve. So I think it's a very important first step, and we look forward to talking more about it in the near future. And I'll end there. I guess one other thing I forgot to say in my presentation that I wanted to just mention was we, as Joe mentioned, the Farm Foundation doesn't advocate, Pew does advocate, and one of the things we do advocate for is appropriations. We recognize the work that FDA, USDA, CDC, all of them are trying to do on stewardship takes resources. So one of the things that we are doing seems to be continuously, since this appropriation process never ends, we do advocate for increased funding across all of those agencies to enhance the work that they're proposing on stewardship. Thanks very much.